pressure 180 millimeters of mercury. Diastolic pressure 69 millimeters of mercury. Heart rate 78 beats per minute. According to WHO guidelines, your blood pressure is optimal. Measurement completed.
Well, there you go, guys. That's the introduction to reverse hypertension. So I have the world's best hypertension. You can't do a blood test. I've got 81 blood tests, all perfect. The best diabetes, the best cholesterol, the best hypertension. And I'm a cirrhosis patient. So guys, just so you can read this, 120/80 normal, 78 is your heartbeat. Now, for those who are pretty fit, that should be around 60. But now, what affects this? This goes up and down every 5 minutes. I'm standing up. I should be sitting down. That'll be like that. That's mine. It'll be 101/62, sitting down. Put your arm up. This one talks. Your doctor's one doesn't. So we've got these for sale, $45 on site, or an extra $20 to go with the book. We don't make anything out of it, but we're so pedantic about you getting assessed and not having a heart attack or stroke. Is that fair enough? If you don't have one of these at home, you are crazy. It's just a must. Now, you heard mine was optimal. I haven't just reversed, I've reversed mine to optimal. That's what you've got to aim for, is the best you can get. 50% of you who haven't got this have fatty liver. That's why it's in the book. It's one of the risk factors under all the guidelines, RACGP 2024. Click the link in the ebook and your AASLD. America, all the latest, it's there, the latest studies. Now, how to fix that up, it's a little bit more difficult, but with the usual diet, drugs and exercise. But the good thing is you can monitor it. You don't even have to use a finger prick for your blood and draw blood. Okay? But you've got to do it. And we have 2 videos on this in the book. Press the buttons. One of the 150 videos. And you could be doing something wrong. You can't be doing exercise beforehand. You can't even be walking. GPs do it every time you see them. But you think, well, oh, I had 124 last time, it's 118, you beauty. It changes every second. And you're not getting consistent results or using consistent method. Don't talk. Now, if I've had 2 cups of coffee, I know that 116 would be 101 if I didn't have 2 cups of coffee. So you can experiment even with your daily foods like caffeine. And I have 4 cups of coffee a day, maybe 6 if I feel like it, and I have a double tea. Because they're both superfoods proven to lower your liver enzymes, or at least with the coffee, to reduce your future risk of cirrhosis. Supposed to have it, and fibrosis, and the tea, green tea. Well, that's 8 drinks, and somehow put in dandelion tea in there as well. How many hours of the day have you got? But the beauty here is there's no excuse on assessment. You are the assessment manager for your case every day. Now, we've got control sheets. Now, you know, you can do a mini book on this. I've seen them in our hypertension clubs on Facebook. They show us their control sheet. Bang, 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 bang. So, you know, keep it at a set time, morning, afternoon, every day. Take that to the doctor. Instead of them doing you once every 12 months, you do. You do yours every day. You be the patient advocate of your own body, and you fix this up, it's going to go a long way towards fixing up your liver. As well, all roads lead to the liver. Now this is assessment of MAFLD, which is metabolic dysfunction associated fatty liver disease. But it also applies if, you know, alcoholic is also fatty liver, but a different source. But it's just a guide, guys, and we've got lots more of that in the book. See you in the course.